Cancer is not just one disease. It is a large group of diseases that can begin in many different cells and tissues of the body. Doctors classify cancer by the type of cell where it starts, because different cells create different kinds of cancer. The first major type is carcinoma. Carcinoma begins in epithelial cells, which cover the skin and line many organs inside the body. Carcinoma is the most common category of cancer and includes many cancers of the breast, lung, colon, prostate, and skin. One subtype of carcinoma is adenocarcinoma. It begins in gland-like cells that produce fluids such as mucus or digestive juices. Another subtype is squamous cell carcinoma. It begins in flat surface cells found in the skin, throat, lungs, cervix, and other body surfaces. The second major type is sarcoma. Sarcoma begins in connective tissues such as bone, muscle, fat, cartilage, or blood vessels. Bone sarcoma starts inside bone tissue, where abnormal cells begin growing within the hard structure of the bone. Soft tissue sarcoma can begin in muscles, fat, nerves, blood vessels, or other deep body tissues. The third major type is leukemia. Leukemia begins in blood-forming tissues, especially the bone marrow. In leukemia, the bone marrow produces too many abnormal white blood cells that do not work properly. These abnormal leukemia cells can crowd out healthy red blood cells and platelets, affecting the body's normal blood function. The fourth major type is lymphoma. Lymphoma begins in the lymphatic system, which is an important part of the immune system. The lymphatic system includes lymph nodes, lymph vessels, the spleen, and immune cells that help protect the body. In lymphoma, abnormal lymphocytes multiply and collect inside lymph nodes or other immune tissues. The fifth major type is multiple myeloma. This cancer begins in plasma cells, a type of immune cell found in bone marrow. Plasma cells normally make antibodies to fight infection, but cancerous plasma cells can damage bone marrow and weaken normal blood production. Another important cancer type is melanoma. Melanoma begins in melanocytes, the pigment-producing cells that give skin its color. Melanoma often starts on the skin and can grow deeper into tissue if it is not detected early. Brain and spinal cord tumors begin in the central nervous system, which controls movement, thinking, sensation, and many vital body functions. Some brain tumors are benign, while others are malignant, but both can be serious because of where they grow. Germ cell tumors begin in reproductive cells, the cells normally involved in forming eggs or sperm. These tumors most commonly appear in the ovaries or testicles, but they can sometimes appear in other parts of the body. Neuroendocrine tumors begin in cells that have features of both nerve cells and hormone-producing cells. These tumors can appear in organs such as the lungs, pancreas, stomach, and intestines, and may release hormone-like signals. Cancer can also be named by the organ where it starts, such as breast cancer, lung cancer, colon cancer, or liver cancer. Breast cancer can begin in the milk ducts or glands of breast tissue, where abnormal cells start multiplying. Lung cancer begins in lung tissue, often in the lining of the airways, where abnormal cells can grow into a tumor. Colorectal cancer begins in the colon or rectum and may develop from small abnormal growths called polyps. Prostate cancer begins in the prostate gland, where abnormal cells start growing within prostate tissue. Cervical cancer begins in the cervix lining cells and is often linked to long-term infection with certain types of HPV. Skin cancer includes several types, such as basal cell carcinoma, squamous cell carcinoma, and melanoma. Pancreatic cancer begins inside the pancreas, an organ involved in digestion and blood sugar control. Cancer can also begin in organs such as the liver, kidney, or bladder, depending on where abnormal cells first appear. Doctors identify the cancer type using tests such as imaging, blood tests, biopsy, and laboratory examination of cells. Knowing the cancer type helps doctors choose the best treatment, because each cancer behaves differently and needs a specific plan. Understanding cancer types is important because every cancer behaves differently, grows differently, and responds to treatment differently. That is why early detection, proper diagnosis, and medical guidance are extremely important. New research, better screening, and modern treatments are helping doctors understand cancer more clearly than ever before. This video is for educational purposes only and should not replace advice from a qualified doctor or healthcare professional. If you found this video helpful, please like this video and share it with someone who wants to understand cancer in a simple way. For more cancer-related information, 3D medical explanations, and health awareness videos, subscribe to this channel. Stay aware, stay informed, and always take your health seriously.